Let's talk a bit about osteoarthritis of the knees. Now, this is a condition we see quite often in practice, and one of the things that I always hear from patients is that they're actually worried to perform exercises or remain active because it's actually going to aggravate their condition. Nothing could be further from the truth. Research has shown that moderate degrees of exercise performed at least 5 days a week can immensely increase flexibility, mobility, and strength in and around your knees. Now, some of the best exercises for osteoarthritic knees are Tai Chi, water walking, and dancing. What you need to focus on initially is increasing that mobility and flexibility of the joints. So let's get into some demonstrations here for some great exercises for the knees. Let's start out with an exercise that's focused towards knee mobilization. So it's basically mobilizing the knee with a towel. Now, we've got Mickey here to help demonstrate. So you're going to take the towel, wrap it around your foot, for a comfortable grip, and then you're going to bend the knee and kind of figure out what your range of motion is. And as you can see in Mickey's case, she's quite flexible here, so there you go. Yeah. So what we're going to do is pulsate about 5 times. So you're going to, there you go. So nice short pulses back and forth. Good. And then after that 5th pulse, you're going to want to pull it in to where you feel that barrier, where your range of motion is, and hold it for a count of 15. Now, everyone will have a different range of motion depending on how severe the osteoarthritis is in the knee, but stay within those pain ranges. Good. And you want to perform this on the opposite side, so we'll just have Mickey demonstrate here. So once again, we're doing nice pulsations, about 5 times. Great. And then at the end, you're going to hold it for a count of 15. That's a great exercise. The next exercise we're going to perform is going to focus on quad contraction. So we've got a towel rolled up, placed right underneath the back of the knee. And what you're going to do is contract the quadriceps, the muscles in the upper thigh here, and straighten out the leg. Make sure the heel comes up, and you want to pull your foot back into dorsiflexion. When you get into this position, you're going to hold this for a count of 3. So 1, 2, 3, and relax. Good. You're going to perform this 10 times on each leg. So we'll have Mickey demonstrate this a few times here. Great. Yeah, pulling the foot back. Perfect. Holding for a count of 3. And back down. So just a great exercise to activate the quad. This exercise is known as prone knee flexion. And a key point here is that some of the best mobilization exercises don't have to be that difficult. So we've got Mickey once again lying here in the prone position, and all she's going to do is bend one leg at the knee, perfect, and then bring it back down, and she's just going to stay within her range of motion. Now this is going to vary between people. Some people may be only able to get to 90 degrees, and as you can see with Mickey, she can almost get that heel to her gluteal muscles. So we're going to do this 10 times on each leg. Great. You can actually switch legs and show them what it looks like on this side. Perfect. So once again, performing it 10 times on each leg. And then once you've done that, and you can just take a break there for a second, you're going to alternate legs. So you're going to alternate, exactly. One time with the left, one with the right. And this one, once again, 10 times on each side. Just a great knee mobilization exercise. Now, to this point, we've actually focused on a couple of knee mobilization exercises, as well as an exercise that activates your quads. The next exercise, a pelvic raise, is going to help activate the gluteal muscles as well as the hamstrings. And that's important because these muscles are key stabilizers of the knee. So we're going to have Mickey help us demonstrate here. So she's going to perform a simple pelvic raise, raising up the pelvis. Make sure you keep a nice flat tabletop-like abdomen here. You don't want to overextend. Perfect. Good. Yeah. Now, so this is the position you want to stay in. And as you can see, you want to make sure that your feet are flat or that you're on your heels. If you were to go on your toes, that's actually going to destabilize everything and deactivate the muscles. Can you feel that?
Yeah, it's weaker.
So keeping the flat feet or on your heels, you're raising up the pelvis, and then you're slowly dropping down. Great. And you want to perform this about 10 to 15 times. Good. How does that feel?
That's good.
Yeah, can you feel the activation?
Yeah, I can definitely relate.
So this is really going to go a long way to help stabilizing the knees. A nice easy way to stretch out the hamstring is a seated hamstring stretch. So we've got Mickey demonstrating, so I'm just going to sit. You're going to straighten out the legs slightly, make sure that the knee is bent, planting the heel on the ground and dorsiflexing the foot, pulling the foot back towards the shin. So this is your starting position. And now you're going to lean forward, making sure your back is flat and straight and the motion's coming from your pelvis. Can you feel that?
Yeah, right behind the knee.
Yeah, it's a great way to stretch out that hamstring, and you are going to feel it behind the knee. You're going to hold this for 15 seconds. Great. And then come back, and you're going to alternate sides, so performing it on this side. Good. So knee bent, foot in dorsiflexion, nice flat back. So holding it for 15 seconds, and you'd want to perform this 5 times on each side. It's a great stretch for the hamstring. Now this exercise is a partial squat, and it's a great mobilization exercise for the knees, but also for the hip and the ankle, pretty much the entire kinetic chain. So you're going to need a nice stable chair, and you're going to stand in front of the chair to start, as Mickey's demonstrating here, about 12 inches from the chair, feet about shoulder width apart. And what you're going to do is drop down into a partial squat. So we'll have Mickey demonstrate. You can see she's keeping a nice flat back. Great, and coming up, bending at the hips and the knees all the way down. Make sure your knees don't go past your toes. And the chair's here to help you just in case you lose your balance. If you happen to fall back, it's going to break your fall. You'd want to perform this 10 times. It's a great mobilization exercise.